Hello, it's Dr. Nebel. Today, I'll share a little bit about my services and who might benefit from those. So, my practice is eclectic, I'll say. I do primary care for seniors. All my care is done in-home or on-site. I felt that was really important as I started my practice during the start of COVID to bring care into homes. People and older adults in particular were being forced into video-style visits. My patients can't use their portal. My patients don't text. A lot of my patients don't even use email. A video visit was not happening, and so I knew I needed to be in the homes for them. I love bringing the care to them because that's where you need it. There's so much information that you see in the home that you don't catch in a 15-minute visit. Most people can pull themselves together for a 15-minute visit. It's a lot harder to pull your house together and present yourself for an hour if there are underlying conditions. I love being in the home. I do primary care in the homes, replacing their PCP, family med, internal medicine, general practitioner, whatever you call it, and offering that service in the home. And then the other thing that I do would be consultations. Getting older is fraught with transitions. I think there's actually a lot of those throughout much of life anyway. But it's the first time most people are going through these type of changes. Family members, spouses, adult children, friends may be observing things and have concerns that know what's normal, what's not normal. And so that's where I come in as a geriatrician, an expert in aging and the changes associated with that. I can help what's concerning and what's normal and not worrying about it. But also at the same time, changing requires change. And so I can help you to plan, look at prognosis for those changes that are happening and understanding how that medical impact is going to affect your daily routine, your ability to care for yourself, your ability to age in your home. So that would be a consultation, and that could be just because of changes you notice with aging. It could be a specific concern, things we call geriatric syndromes, constipation, sleeping problems, isolation, withdrawal, depression, memory changes, gait and balance issues, incontinence, all of those type of things that you may or may not see. And so I can do consultations on those. I can do consultations on dementia or memory changes that family might be noticing. Especially as we are approaching the holiday season, you'll probably be seeing family members or friends that you may not have seen for a while. You might start to see things and just not be sure, is that normal or not normal? Those are the things I can help with. And the other areas that I do is a type of field evaluation called capacity or medical capacity evaluations. And so that would have more of a legal need. Sometimes there's questions about whether a person can make decisions for themselves, whether that's life decisions. Can they manage their finances? Can they make healthcare decisions? Can they do estate planning, business succession planning, or advanced care documents, sign a power of attorney? Or are they not able to do that and need to have proceedings with an attorney and potentially court for a guardianship? In addition to direct medical care and evaluations, the other services that I offer are really just caregiver support and education. Sometimes your family member may not want to see the doctor to talk about the concerns. They either don't see them themselves or they're protecting themselves. And so sometimes families just need guidance on how to approach that, what the next steps would be. And that's also another area that I'm happy to help out with. So thanks for making coffee with me today. Have a great day, and I'll see you next time.